Welcome, everyone. Thank you for joining us today. My name is Inder. I am part of the administrative team here at IHN. I manage IHN Student Clinic. I am a program advisor, as well as I help to coordinate field trips and the holistic food prep course. And then I also am part of the communications team. So thank you for attending Bal's webinar this evening, where he will be speaking about the comparative use of supplementation for various digestive issues. This webinar tonight is an extension of Bal's ConEd course, Supplementation in Clinical Practice. So the itinerary for tonight is a 1-hour lecture followed by a Q&A. So if you want, you can keep your questions till the end. So I'm just going to read a little bit of a bio about Bal. So his name is Baljinder Chhoker, also known as Bal. He has been an educator and consultant in the natural health industry for over 20 years. He graduated from the University of Waterloo with a Bachelor of Science degree and the Canadian College of Naturopathic Medicine with a Doctor of Naturopathic Medicine diploma. For the last 8 years, Bal has been the national educator and consultant for Bio Lunrico and Dr. Reichwig. He does in-office and online trainings educating practitioners, naturopaths, and retailers on various homeopathic and nutraceutical products, as well as recommended protocols for practicing clinicians. He has also provided consulting services for several pharmaceutical and natural health retailers for many years. He has a vast knowledge of all the natural health supplements on the market. Baljinder has taught human anatomy and physiology at the Institute of Holistic Nutrition in Toronto and Mississauga campuses. He currently shares his expertise in his continuing education course, Supplementation in Clinical Practice. So I hope that you all enjoy the course. I took this course a few years ago with Bal, so I just gained so much knowledge. I still refer back to my notes often when I'm working with clients. So I really hope you guys enjoy it tonight, and I'm going to pass on the floor to Bal now.
Well, hello. Thank you. Thank you, Inder, for all of that. It makes it sound like I do a lot, but I don't think I actually do anything. So I think I should revamp that bio to really does nothing. Seems like it's way too much, but either way, I enjoy what I do. So, and I enjoy lectures like this. It's part of my course. This is the guest lecture for that. Just gives you a little preview of what I actually do when I do the teaching. But I actually totally revamped this one. I added some other stuff in it that were not taught before. I never touched up on some of the guest lectures I did. So I thought I'd give you guys a little extra tonight. So thanks again for showing up tonight for my lecture. I hope you find this informative. Tonight we will be talking about digestive health issues and how to look at various supplements and compare these supplements to these particular conditions that are basically plagued most people. And when we actually look at the fact that she's already talked about me, so we'll talk about supplementation and digestive issues here. So 20 million Canadians suffer from digestive health issues per year. With a population of 35 million, all right, 2/3 or over 2/3 basically suffer from digestive health issues. So that's a lot. And I know that, many people who have gone through this course have personally suffered health issues, and a lot of them being digestive issues. And this is what brought them into this field. And, you've helped yourself out, and now you are helping other people out. And this course, this lecture tonight hopefully will assist you in that process on top of that. All right. When we look at this, maintaining a healthy digestive system, we know it improves everything within our body. But again, gastrointestinal disturbances are very rampant with most people. Things like weakness of the digestive organs, inflammation anywhere along the GI tract. This is what causes the pathologies. And those being just general, digestive discomfort, regularity issues, constipation or diarrhea, right? But we can go worse. It gets down the line if it's not taken care of properly, right? Hemorrhoids, reflux, ulcers, IBD, and even chronic infections. And the whole thing is that we need to control this stuff quickly. If not, it pushes it down the line and we get further pathology. And that affects our growth, our immunity, and it leads to nutritional deficiencies, which then, affect everything else that's going on within our body, the overall energy aspect and so on. But we've got tools to help you with that. And when we look at supplementation, right, there is a lot out there. Much like shelves. If you walk into a store, shelves full of supplementation, for various things, including lots and lots for digestive health. All right. But we're going to look at tonight, we're going to narrow those down for you. We're going to look at some of the key supplements for digestive health issues that will, in most cases, get you going with the people. And I think that these supplements we're going to talk about tonight will help get you going with most people. And you always have to cater to the individual. I think that one of the most important things I mentioned in my course is catering to that individual that's in front of you. It's not about protocols. All right. And what you see tonight, it's not about protocols at all either. It's about what will fit with your patient, that individual that's in front of you. I think that's the most important thing that you need to know when there's somebody in front of you, is that this isn't the general public, anybody coming off that you can treat the same way. No, it's an individual with their own symptomology and their own picture that you have to cater to that individual, not just a general protocol that you can use for everyone out there. And hopefully it will do the job, because it will not do the job. Okay. You always have to fine tune for that individual. And so we're going to look at some of these things that you can get started with, and then you have to do the rest of your work to, as I said, cater to that individual. So we'll look at the different pathologies behind all of this. We'll look at the different modalities. We're going to be talking about botanical medicine, nutraceuticals, homeopathics, essential oils. And we'll see some of these companies. Well, actually, we'll see something from all these companies that we have here and other companies that are not listed on top of that. All right. There's a lot of things out there, and you need to know how to use all of them. Let's start off here. A square peg will not fit in a round hole, and a straight wood will not make a wheel. Gauge each material according to its use, for use against its nature brings difficulty. You need to know your remedies. You need to know what these remedies do, where they work, how they work. All right. So that, again, when you listen to your patient, they're already clicking these things in of what's going to be, what's going to be helpful to that individual. All right. Because if you don't do it right, hopefully the worst thing is that nothing will happen. But you'd never want a reaction that you are not aware of. You never want to take something and inflame it more if you don't use it for the right purpose. Okay. For example, actually just had a phone call just before we started. I started this lecture. Somebody called about UTIs. They thought they had UTIs. They've been on 3 rounds of antibiotics. And in the first 2 rounds, it made it worse. What do we see on the screen, right? It brings difficulty if it's not right. And they still got put on a 3rd antibiotic, and it has not made a difference. You would think that after the 2nd round, when things got worse, that maybe you're dealing with the wrong thing here. And maybe there's a different way to treat this. But if you're not looking for all of that, you will create problems for people. All right. So it happens, and you got to be careful of that. So as for the digestive system, I think you all know this from anatomy physiology. I'm pretty sure you've all taken it. We got the GI canal or GI tract, and we got the accessory organs. So that hollow tube from the mouth, including the pharynx, esophagus, stomach, small intestine, large intestine, all the way to the rectum. All right, that's that outside tube. That's actually where you're putting food in, and eventually all the waste leaves. But there's more involved in digestion. There's the accessory organs. These are very important. The teeth, the tongue, If we don't actually have teeth, kind of hard to eat solid food. So then you have to change the type of food you're eating. All right. If there are tongue issues, there are going to be swallowing issues. You can't propel that food back. So again, you're left with almost a liquid diet if that's the case. So you have to know the individual in front of you if there's issues on the accessory organ side. Liver, gallbladder, pancreas. If somebody's missing a gallbladder, you have to be careful of the heavy meals that they're going to eat, or they're going to need assistance with that right away. So all of these accessory organs are very important to the GI tract, okay, and helping with the food movement and metabolism. So what is the general function of the digestive system? Again, anatomy, physiology, right? But we'll go through it really quickly for you. Well, the number one thing that the digestive system is doing is actually providing fuel for our body cells. It is taking the food that we take in and eventually giving us energy. That's the purpose. And, there's 5 main steps. And if there's an issue anywhere along these steps, well, we know it's something wrong because we don't have the full energy we're supposed to have when we eat. All right. So there's ingestion. That's the food being taken in. There's the movement. So when we look at that, that's the propulsion. Right? Movement of food all the way down. It's actually getting pushed down all the way. Peristalsis is all taking energy. Movement, food isn't just dropping down like gravity through this tube. It's taking a lot of energy through those muscles to be able to push it down. So energy just to produce energy, right? We need a lot of energy in all this. Then there's the actual digestion. All right. Number 3, there's the mechanical. That's the chewing and the churning, in the stomach, and then the segmentation in the small intestine. And then there's the chemical digestion. So when we think about the hydrochloric acid, the enzymes, all these that are trying to break up that larger part of the food into smaller usable things, right? That's the true digestion that happens. And then we have to absorb these small particles, and that's basically done in the small intestine, large intestine. And that happens directly into the blood, which does take energy, or through the lymph where the fats usually go, which is just straight absorption. So that's actually the least energy utilized, actually no energy for the absorption side of it. And then eventually there's the elimination, any of the unwanted food particles, anything that's left over, not digested, right? Mucus and bacteria, things like that, all eventually go out. So all that happening just to give us some energy. So there's your basics on the whole digestive system. But I think, again, you guys know the stomach has got a lot of things in here. It does a lot for you. All these cells are very important to help with the whole digestion process. Hydrochloric acid, the mucus that's produced, the pepsinogen that's produced in all these things. And then also the CCK to help slowing down the stomach emptying, so keep somebody full longer. That's the purpose of the stomach. All right. Small intestine. This is where we actually absorb most of our organic molecules, the glucose, amino acids, fatty acids, and some of the vitamins and minerals are absorbed through here. Water all the way through the intestine, of course. We absorb our fats, in the small intestine also. And then the large intestine, where we absorb most of our water. That's where the balance starts to happen. The B vitamins, we actually help produce in the large intestine, the vitamin K and the B vitamins also. And then eventually, of course, the waste is sent out. So we've got pathology in all of these places. And that's actually what we're going to be looking at now. All right. So there's local and systemic issues. When we have something that is local, if that problem is not taken care of, it will lead to systemic problems along the line. So you need to let your patients know, hey, I want to see you at the slightest change of something that doesn't feel right, so that you can attack this issue right from the get-go so it never becomes a systemic problem. And these problems are going to be either structural or functional. And again, anywhere along the thing. We could have allergies. We could have inflammation, reflux. We could have erosion, malabsorption, and even tumors, right? So this is all going to be blockages or hindering, absorption through everything. We could have various infections. We all know there's lots of gut flora imbalances happening for a lot of people. And of course, transit time variations, which Normally, constipation is very common. Diarrhea, normally we want to nip that in the butt right then and there. But constipation, a lot of people will walk in with that. So we'll be looking at these things, all right? Some of the symptoms we see: bloating, diarrhea, gas, cramping in the stomach and in the intestines. We can get burning, and this is where the reflux and everything starts to happen. Nausea, vomiting, and of course irregular appetite. These are all telling you there's something wrong in the digestive system that needs to get rebalanced. So here's some of the things that we commonly will see for digestive issues, and we probably will be looking at a lot of these things in the formulas that I've got, coming up. So general stuff, of course, digestive enzymes, bitters, there's various things that all help to break down the food better when the body is not able to cope with what's coming, what it has. Prebiotics, probiotics, and fiber, all important for regularity side of it too. There's the whole nervous system side, because we got a lot of nervous system in the gut. So sometimes you need these nervous support remedies, 5-HTP, theanine, GABA, because the anxiety and things like that people experience. Then we got, more of the healers: glutamine, DGL, mastic gum, zinc carnosine, these, for erosion and malabsorption stuff going on. Healing herbs, slippery elm, marshmallow. I'm pretty sure you guys have heard of all the individuals. We're just going to talk about them in formulations tonight. Peppermint and even laxatives sometimes are needed. So, when the weapons are not sharp and the equipment is incomplete, it is the same as having no weapons. Again, you need to know your remedies, and I think this is where a lot of practitioners limit how they can help someone. They stick to one or two lines because they feel that enough is in those lines to help as a protocol. Again, I don't believe in protocols, right? To help with a general protocol for people. Well, that's not actually how the individual, again, works. You need to have a huge selection of remedies in your repertoire. All right. Again, we're going to see remedies from, I don't even know, 7-8 companies tonight. In my course, I actually have about 25 vendors, in a way you can say, companies that I talk about. So you can't get away with just one company. That's an incomplete arsenal that you've got if that's the case. All right. So you have to be open to be able to use other stuff and other modalities. I'm going to show you some newer modalities that you probably wouldn't even think of when it comes to herbal jam and essential oils. All right. For digestive stuff. So let's get started on that. All right. So first, we are going to talk about probiotics. And again, from this point on, if you do have any questions, again, raise your hand. If it's, again, relevant to what's on the screen, I will try to answer and clarify for you on that. Otherwise, again, put it into the Q&A and we'll answer that at the end for you. Okay. So intestinal, the probiotics, this is the good bacteria in our gut, and not just our gut, actually from the mouth all the way down, we actually have different type of probiotics. All right. And you can actually get specific ones. You can get chewable ones, which I'm not even going to talk about, just for oral health. But we have targeted ones for the small intestine, targeted for the large intestine, targeted for immune issues, things like that, because they support digestive health and regularity, assist in nutrient absorption and production of some of these nutrients, promote healthy growth, prevent allergies, improve immunity, inhibit intestinal pathogens. Also very important for weight loss and regulating metabolism. And also promoting skin issues, promoting allergy, minimizing reactions to that too. So probiotics do a lot, but I also think that people give too high of a number of probiotics on an ongoing basis. I don't think most people need 50 or 100 billion or 500 billion out there on a regular basis. I think that's overdone. Those are a select few individuals that will need that for short term. generally you don't need too much. Yes, we're wiping them out, but we should also be assisting in their growth. And so small amounts on a daily basis, I think, are more than enough for most people. And you can still cycle that. Not everybody needs to be on 100 billion daily. All right. Or, more than that. I think it's just too high for no reason. So we're going to talk about different types of probiotics first, because probiotics are really important for digestive health. Okay. And this one here, we're going to start off with New Roots Acidophilus Ultra. This is a very good economical, as we see here down at the very bottom, economical choice of a probiotic, but it has all the transient strains also. So we've got 11 cultures, 11 billion in an enteric-coated capsule, which gives us some human strain, plant strains, dairy strains. And by the way, even though those types of strains are there, all right, it's rare that you're going to react to any of the dairy strains. All right, you won't really. That's really what it comes down to be. Most of the probiotics, there's actually no dairy in it or dairy proteins. It is just the probiotic, and that way you should not be reacting to that, just so you know. But this one here is one of the best choices for overall general everyday, if somebody needs support for keeping their immune system good, helping improve their absorption of nutrients. And it doesn't have much for the large intestine in the bifido, but it is there somewhat of a support. Really, this is about immunity with the high rhamnosus that's in here at 7.7 billion of the 11 billion is rhamnosus. This is a really important probiotic for the female vaginal tract and the urinary tract in promoting proper and probiotic growth, all right, and preventing infections. And that is also, in general, really good as an antimicrobial for anyone. So this is a great immune support probiotic that people can be doing more so on a regular basis, or coming up to the winter time, if that's the case, right? Keeping their immunity up. Being enteric-coated doesn't matter when you take it with or without food. It's going to break down to the small intestine. I think that's really important to know. Targeted delivery sometimes is really important of how to make sure something gets there. All right. So 1 or 2 capsules daily. These are very small capsules. Almost children can actually take these things, and really good general maintenance. This is one that I think probably every single one of you have heard about. All right. The Genestra HMF Forte. This is a really good human strain. First of all, HMF stands for human strain microflora. So human strain, 10 billion per capsule, but we only have the key lactobacillus and bifido strains in here. This is, again, higher small intestine support. When we look at this thing, approximately a 4-to-1 ratio of lactobacillus, which is mainly in the small intestine. So that's your absorption and your immunity. And bifido is for the large intestine. We have a lot lower amount in here. The good thing about human strain, I think, is most people don't know that majority of the human strain, pure human strain, are not enteric-coated, because they are more resilient to the biosalts than all the other strains, that you don't need to have it enteric-coated. You're going to get that delivery because they're more resilient overall. So again, 1 or 2, depending on the situation with this, a great immune support and helps with the absorption of everything in the gut. This is actually one of my favorites. And the reason for that is the fact that it actually has a 50-50 blend of small intestine, large intestine. So 15 billion total per capsule. So 7.5 billion of bifido, 7.5 billion of acidophilus. And again, I'll repeat, lactobacillus, its main area that it works in is the small intestine, and bifido in the large intestine. So bifido helps with the regularity, bowel movements, transit time. So with this one here, for most people, as I said, a lot of people are constipated. And if they're mildly constipated, My choice really in probiotic for them is this one here that gives us equal support for the large and small intestine. All right. Excellent. 1 a day human strain is what we have here again. That's why it's not enteric coated, but helps with the regularity and also helps with the actual absorption of all the nutrients on top of that. But really good support for regularity of the large intestine. Whether you need to do 1 or 2 just, again, depends on how bad that regularity is. And going even further down to the large intestine, progressive colon care, 50 billion. This is one that actually has, as it shows here, of the 50 billion, 90% is bifido. So that's support for the colon, right? So 40 billion, right? Of that 50, actually over 40 billion, what am I saying? Of that 50 is bifido. So large intestine support. So somebody who's severely constipated or they've got inflammatory conditions in the large intestine, in the colon, they need that higher bifido for support, for repopulation, for controlling any pathogenic growth, helping with, controlling IBS-like symptoms. That's where this colon support works, in that whole area, to make sure that we've got regulation. And if we got regulation, we've got nutrient absorption going on top of that. We're not losing stuff, all right, all the time. So it will actually help people get their energy back up on top of that. So that's where the progressive colon care targeted mainly for the large intestine. So it's going to be specialty when we really look at this. 50 billion, again, because there is a huge problem down there. That's why we're going that high. 1, maybe even 2 capsules to help control everything. And a lot of times it's going to be a diarrhea kind of state where you might have to use something like this, so you get that targeted enteric coated delivery on top of this, all right, gets you down where you need to help control everything. So 1 to 2 for the large intestine support. Enough of the probiotics, which you will be using no matter what we're going to be talking about at this point. All right. Doesn't matter if it's constipation, diarrhea, whether it is inflammatory conditions, you need probiotics. Okay. It's just a matter of what dosage you need and what specific type you need. All right. You see why I say that you need to be dealing with many different companies so that you have the right product for that individual. And that's just probiotics. Now we're going to go through the rest of the stuff too. So gastric juices. This is now what we're talking of helping to metabolize our food. Gastric juices include hydrochloric acid and enzymes that are needed to metabolize our food. They help with decreasing gas and bloating, promoting regulation, help obviously improve immunity, and decrease sensitivities. Now, there's a couple of ways to do this. The corrective way is to use herbal bitters. Stimulate the production of these enzymes in gastric juices. All right, but it takes time. Problem is that people want treatment yesterday. So when you tell someone, hey, we can do herbal bitters, but you might get a little bit of relief right now, but in the long run, and it could be months down the road, we'll probably have everything fixed up that you don't need to take anything. People want support right away, right, with their gas and their bloating and their regularity. So this is why we use normally digestive enzymes. Digestive enzymes should be a short-term thing. While we're correcting the diet and the lifestyle and things like that, right, you use digestive enzymes. Issue is they work as soon as you take them. People love that because that's the mode that they're in, right? They feel good right away. So they rather just stick to digestive enzymes. And that actually, in the long run, you become dependent on. So you have to be careful. I think that if that's what you want to do, you can start off on digestive enzymes and then move back into herbal bitters to kind of promote that thing. Okay. But that's me. At the end of the day, is that people want results right away. digestive enzymes provide that. And we got different types of digestive enzymes. We're going to look at, there's plant-based enzymes, there's animal-based enzymes with or without hydrochloric acid, and there's specialty formulas for sensitivities. Lactose, dairy, gluten, things that people are highly sensitive to, can't break down, and then they react if they take this in. So we can give them a specific formula for that, assuming that they cannot just take it out of their diet. Best is avoidance in this case. All right. Just change your diet so that you don't have any of this stuff, but you never know. You can be out and about and, you're going to a party or something where you don't think you're going to find anything that you can have. You might want a digestive enzyme to keep handy for that case so you can actually have something without reacting. So first of all, a line that you probably haven't heard of, Super Diet. This is actually ampules, liquid ampules of pure herbal extracts without anything else in them. This guy here, Super Diet Drainaflora Digestion, single dose ampules. You can kind of see that tiny picture over here. Single dose ampules that are for bitter enzyme support. So bitter properties to stimulate digestion. We got things like milk thistle, gentian, artichoke, and black radish. Those are bitter herbs. So they are stimulating, and gentian being the main one, along with the black radish, of stimulating gastric juice production, stimulating our appetite, stimulating the liver to start producing, and the pancreas to start producing enzymes. Right. So this is the corrective way. Bitter stimulation of digestion. And in here, of course, the cumin and the caraway are here too. So they help with, calming down the irritation and, the gas and the bloating for the more immediate support. But really, this is something where you want to take an ampule once or twice a day, usually before the bigger meal, to stimulate the enzyme production so that over the long term, the body corrects itself. When you have enough food in and you have enough stimulation in, you don't need anything else. So this may take a couple of months to start doing the job for you, but it can do the job. And that's really, to me, the corrective way to do it. But as I said, people are kind of lazy. This isn't their first choice in most cases, but really good way overall. One ampule daily, maybe in the morning to overall stimulate, but you can do another one with a heavy meal just to stimulate a little bit extra the actual gastric juice production. So get the stomach stimulation up to par much quicker. The other way is hydrochloric acid. Hydrochloric acid is really one of the biggest stimulants for, again, gastric juice production overall, enzyme production. What we see on the screen here, we see the BioClinic betaine HCl. That's what I call the vegetarian version. And we got the NFH hydrochloric plus pepsin. That's the non-vegetarian version, which is still, I think, the better product with the pepsin in it. But I want to give you the option because there are going to be vegetarians that won't be able to have certain items. Okay, so here's a good example of where you do have a great option for that. Hydrochloric acid, again, enhances digestion. It stimulates the actual gastric juice production, enzyme production. It activates the pepsin to start stimulating protein breakdown. Okay. So overall, it's one of the key things that people need. A lot of times when people have digestive issues, gas and bloating, they think an enzyme is what they need. Usually they're producing enough enzymes, but not enough hydrochloric acid. So the hydrochloric acid will stimulate the enzyme production even more. All right. So get that pH in the stomach where it needs on top of that. Okay. And that's how it actually helps with bacterial, killing off as an antibacterial on top of that. So preventing bacterial infestation, preventing H. pylori, things like that, if you've got enough hydrochloric acid in it. Now, these guys here, the BioClinic, 500 milligrams of hydrochloric acid, along with the fenugreek. And the fenugreek, of course, is like more of a digestive stimulant. On top of that, it helps with gas and bloating too. And the other one is hydrochloric acid, 700 milligrams with pepsin. And so where you see Sucrofa, just so you know, that means pork-based. Okay, so pepsin is pork-based in this case. All right, that's the source of it. And we got 75 milligrams. So we got direct protein breakdown happening with the pepsin in here. So it starts the activation process. So either or, but what you need to do with hydrochloric acid is test how much they need. There's two ways to test. You can actually swallow a pH strip on a string and pull it back out, see what your pH is at. Really tough to do. Just think about that. Just think about this thing going, close your eyes, think about this thing going down and then trying to then fish it back up from the stomach. Ugh. All right. The other way, of course, is to start taking a lot of hydrochloric acid to see how much you truly need. If somebody needs hydrochloric acid, they probably need about 2, 3, 4 grams of this thing. So which means, you're talking about 4, 6, 8 capsules sometimes of this stuff to make sure they got enough stimulation happening. So normally I tell people, hey, start taking about 3, 4 capsules, 15 minutes before each meal. And, when you take it, you're looking for a burning sensation to happen. If by taking 4 capsules, you don't get that burning sensation with that meal, next meal, take it up to 5. All right. And you keep going up until you get that burning sensation for within about 15 minutes. All right. Then you want to eat right away. Okay. So let's just say now you take it up to 6 capsules, you get that burning sensation. Next meal, you come down to 5. You stay at 5 until, it could be a week. It could be longer. It could be less. You get that burning sensation. Then you bring it down to 4. So you see, you want to start off high, come back down so that the body has adjusted to how much it's naturally supposed to produce. I've had people take 12 capsules before each meal, right? So depending on how much you truly need, but that will stimulate all the enzyme production. So you can, again, like bitters, cut this thing out and let the body do what it's supposed to do. So that's one of the ways to do it. The other way, of course, I didn't put any regular digestive enzymes in. So let me just tell you, something like a Thorne Biogest, NFH digestive enzymes, digestive enzymes. These are all great digestive enzymes with hydrochloric acid in it. Okay. So those will help in breaking down the food right away. So those are your hydrochloric acid-based, pancreatic-based enzymes that are out there. All right, Thorne Biogest, NFH is digestive enzymes, and that's what it's actually called, digestive enzyme, SAP, and now digestive enzymes. There's plant-based enzymes like Digestin from Alpha Science, really good digestive enzyme, New Roots plant digestive enzymes. So those are for the vegetarians. The difference between the pancreatic-based and the plant-based, pancreatic-based enzymes work in a very narrow pH. All right. So they need to be in that acidic environment to work. And that's why they normally have hydrochloric acid put into it. The plant-based enzymes work in a more broad spectrum pH, anywhere between 2 to 12. So they normally can work in that range, so you don't need the hydrochloric acid. But I found that they normally don't work as well as the hydrochloric acid-based pancreatic-based enzymes. So normally that's the preference, unless they're a vegetarian. All right, then you think of the plant-based ones. The specialty enzyme here, BioClinic Digest Pro. This is the GDHP. That means a gluten dairy. Okay, sensitivity digestive enzyme. So what we have here is for those people who are having issues in breaking down gluten, the DPP4 that we see over here, that is one of the most important things that will help break down the gluten that people are sensitive to. Okay. So when that's an issue, looking at a DPP-based enzyme, such as this one here, will help to break down that so there's less of an inflammatory allergic reaction to that gluten. Now, this also has extra support for dairy on top of that. Okay. So we've got support for most of the common sensitivity or allergens with this formula. Hopefully they only need to take this as needed. So when they're out and about, at that time, that's it. But if somebody, for whatever reason, cannot avoid these things, right? Maybe they're not cooking their own meals, that happens. So then they can't do that. So then you would want to make sure that they're taking this on a daily basis. Because if you don't, more histamine, more inflammation, more erosion, poor absorption. So that's going to affect their growth, their metabolism, and everything. So if they need a sensitivity enzyme, make sure that they're getting it if they cannot avoid the food. So it could be one or two, depending on, again, how sensitive they are with each meal, if need be. So very specific for that. And there's others out there. Don't forget, this is just a small selection of what I'm going to give you and let you know that, there are other ones out there. I mentioned accessory organs before, the gallbladder. Gallbladder is just a holding tank for the bile, right? A holding tank. It's produced in the liver, goes to the gallbladder, and then when the food comes into the stomach, it recognizes that, okay, it's going to come down into small intestine soon. So it pushes it out and puts the bile into the small intestine to break up the fats or emulsify the fats better. If you don't have a gallbladder, the stimulation is just for the liver to produce. Now, by the time the food gets into the small intestine from the stomach, you might not have enough bile down there to break up or emulsify those fats. So that people feel heavy, they feel excess bloated, and it throws off their, the regularity on top of that. So this is when you want to look at a product like this, iCall Plus. iCall Plus is really for those people who either eat too heavy of a meal, nothing else, but they just eat too heavy of a meal, like a fat-rich meal, and for whatever reason, they can't stop, all right? Or those people who don't have a gallbladder. This product has the ox bile in it. So it's actually going to give you the bile that's needed to emulsify the fats for that particular meal. But the rest of the stuff help to stimulate bile production on top of that, so that the body is also helping produce more, while the short term, what's in here, is helping to start emulsify, and the body is starting to produce more faster to get it down where it needs to. So this is for people who don't have a gallbladder. That's really the ideal person to give this to. Okay. So they might only need it for, let's just say, dinner, because that's their heaviest meal. And that's fine. If their other meals are not fat rich, they don't normally need it. So as needed, again, 1 or 2 capsules, all right, for that purpose. Now, Genestra also makes something called just Genestra iCall without the plus. Okay. And that one is the vegetarian version because it does not have the ox bile in it. So it has all the other stuff minus the ox bile. So you have stimulation happening, but not direct emulsification happening. So that one you would almost have to take about half an hour before you eat to start getting that production happening in time. Okay, so you do have an option with that. So that's your digestive enzymes. All right. So those probiotics, digestive enzymes, those are your most basic things. Now we're going to start talking about, and I know the time is, going, and we're only halfway. So we'll kind of speed up the pace a little bit. We're going to talk about constipation. All right. I think everybody knows what constipation is: hard stools or infrequent stools. Important thing is, and this is actually going to be important for diarrhea too, of what really causes it: lack of lack or deficiency of water or dietary fiber. Traveling is a big issue because a lot of people don't like to use public toilets. Right? Medications can definitely cause this, and a lot of painkillers can definitely do that. Okay. Metabolic issues like depression, hypothyroid, anxiety can also cause this. lack of exercise, and terminally ill patients where they have a lack of muscle tone are all reasons for people to have constipation. And most people are constipated. Medical definition, once every 3 days is kind of a constipation. Nah. If you're not going daily, if you're not going at least once a day, you're constipated, truly. That's actually the proper definition as far as we're concerned, all right? Because we don't want toxic load in the system. We want it moving out daily. So what can we do about it? The number one thing is give a laxative, and that's only if it's very severe. So Super Diet, again, this is actually their laxative formula, the rhubarb being the main thing that's going to make you go. So laxatives are for short-term use only, 3 to 5 days. They actually irritate the bowels to make you go, but you can become dependent on them. So yes, you might need 2 or 3 pills a night to make sure you go for a couple of days, but you need to go back and address the lifestyle, the food and everything to make sure that they are going regular. But you can't stay on a laxative long, but yes, it will help in the short term to make sure that things are not going to get worse. Next, we move on to something more gentle, Biomed Colon Cleanse. This is something that you can stay on for longer because it supports the system. A very mild laxative in the prune plum extract. But the other stuff is fiber, right? So again, form the stool, soften the stool. Triphala is a wonderful detoxifier and a promoter of regularity. We also have slippery elm that's going to actually help heal, and a digestive enzyme. So you see, this is a great overall support formula, trying to maintain the regularity without a laxative or an irritant. This is something that you can be on for weeks, months, not a problem, to try to get them regular. Just about dosage. Whether they need 2 capsules, at night, whether they need 4 capsules or 6, right? It's just about what keeps them regular, makes them go in the morning. Homeopathics. I don't know how many of you are familiar with homeopathics, but I'm a huge homeopathic fan, and they're a great addition to whatever else you're doing. R37 is for constipation and colic. All right. So this is actually going to help start stimulating the proper function of the digestive system. You can use this to phase out laxatives. You can use this for, when somebody's toilet training, because you never want to get constipated at that time. It doesn't matter why the constipation, right? It could, that list that we said earlier, right? It could be travel issues. It could be poor diet issues, whatever. This is actually going to try to retrain the intestine, stimulate them to do what they're supposed to do. It's going to help decrease colic, decrease flatulence, because we have liver support remedies and things like that in here too. But great to wean off people off of laxatives, but great for any age. 5 to 10 drops, 5 for kids, 10 drops for adults. And you can actually do this at a greater frequency until they get a bowel movement. Right. So it's a great addition to something like the Biomed product. While you're kicking that in, you support them with something like this to retrain the body what to do. And then, for people who are constipated, they also get a lot of gas, bloating, cramping, so on. Essential oils are wonderful for that. This formula here, the Pranerome essential oil formula, and they have obviously liquid essential oils, but these are the pills that, it's a lot easier for you to look at and use that for oral purposes. Oleocaps number 3 are digestive comfort. What we have in here are essential oils for oral purpose. Again, we're going to actually ingest these. They're measured doses, so you can do that, all right? To help with the gas and the bloating, to help with the pain that sometimes people have because they're so bloated. Right. And these things also stimulate enzyme production on top of that. So really, they're carminative overall. So people who are bloated, they got cramping, they got low enzyme production, they even have nausea or seasickness, things like that. So these, especially like the peppermint, will help with all of that. So this is for the people from the constipation that are really bloated. They got to loosen all those belts. All the way down, open it all the way up, things like that. So it helps to alleviate the gas, decrease that bloating and so on much easier. You can use peppermint by itself, but the blend here is wonderful for that. So a lot of symptomatic support here. And then fiber, of course, we already said one of the number one things is lack of water, lack of fiber. So fiber is really important for the regularity, for forming the stool, making sure you go normal. And this is one of my favorites because it has a full blend of fibers. It also has some probiotics in it and herbs to heal the gut back up. So softens the stool and promotes, again, the general regularity. The only thing about fiber, if somebody is severely constipated, they're not going daily, do not give them fiber until they are going regular. Otherwise, it will make it worse. And then the other thing that can happen if somebody's severely constipated, they can get nauseous. And R52 helps with the nausea, the motion sickness. It doesn't matter from wherever the nausea is from, whether it is, again, digestive related, whether it's pregnancy related, whether it's motion sickness from C, whatever. This actually helps with any type of nauseous feeling and the sensation to vomit on top of that. Again, 10 drops as needed to support that. And as I said, a lot of people are overly constipated. When they take something in, they almost want to throw up. This is really good for that. Okay, moving on to diarrhea. Watery stool. The issue with this is the fact that you can lose electrolytes and you can get very weak if it's not controlled well. The causes, food intolerances and allergies. All right, big problem, because it's going to cause more inflammation in the system. And inflammation, and we know this for Crohn's, colitis, and IBS-like things, inflammation decreases absorption of nutrients. It's like a brick wall, nothing's going to go in. So food allergies are, the number one thing, but that inflammation is a big problem. So the lack of electrolytes, right, absorption-wise, is going to make things worse. Infections can cause diarrhea. Medications, again, can cause diarrhea. And I just mentioned, functional disorders, the inflammatory conditions can cause that, and even traveling, because if you drink water that just isn't clean enough, obviously, you can get diarrhea. So when we look at that, there isn't that much for diarrhea, but one of the key things is high-dose probiotics. New Roots probiotic urgency, as the name suggests, right? You have this urgency to go. So this is really about the fact that we have high amounts of probiotics. Here's the time to use it. All right. There's pretty good bifido in here. It's not overly high bifido, but it also has rhamnosus, which is the antimicrobial, right? So we've got these antimicrobial type of probiotics in here. Right. So traveler's diarrhea, we can kind of think of that too. Right. But good enough bifido, it's about the quantity. You're looking at doing 2 capsules twice a day. And usually within about 2 days, you can control this thing. I know that's actually not fast enough. All right. But that's pretty good that at a higher dosage. So you're talking 200 billion. But 2 capsules twice a day will actually help to control that diarrhea, usually with the probiotics like this. But R4 is actually the important thing here. This homeopathic is a must for traveling. This, regardless of the cause, whether it is, nervousness, whether it is pathogenic related, whether it's bad food that you ate, doesn't really matter. This actually helps to control that diarrhea, controls the intestinal cramping and things like that. It doesn't matter, again, if it's inflammatory related. Helps control all of that so you get off the toilet very quickly. The thing is, 10 drops every hour, half an hour if you need to, until you get things under control. Really important for when you're traveling, because you never want to be sitting on the toilet too long. All right, ruins your vacation. And then for those people that have diarrhea, usually there's a lot of gas, bloating, gurgling, and things like that. Activated charcoal. Activated charcoal acts like a sponge to clean everything up and allow for the easy release of things. So it actually helps to calm the stomach down, decreases any burning and things like that too, and helps get rid of that gurgling, right, and control the gas and out. So it's a sponge for toxins. So that's something that you may need depending on how severe, and it might be near the end stage of that diarrhea that you would use activated charcoal. And then oleocaps, same pranarome that we talked about. This is number 2. Number 3 was the comfort one. Number 3 is the antimicrobial. So antiviral, antibacterial, antifungal. The oregano that's in here and the cinnamon are potent antimicrobials. All right. So they decrease the pain, the infection, the nausea, everything associated with, intestinal overgrowth of something. All right. So this can be done usually 2 capsules 2 to 3 times a day to help kill off. Then the probiotics come in to actually help stabilize things. And if you're traveling or you've been on antibiotics, right, you want Saccharomyces boulardii. If that's the reason for your diarrhea, the antibiotic use, or sometimes even, pathogenic overgrowth when you're traveling, Sacro B is the key one that you need for that purpose. So Restore, NFH, Restore SAP provides us with 5 billion of Sacro B plus some of the other the general probiotics to help control antibiotic-induced diarrhea and also traveler's type of diarrhea. So again, use the right one for the situation. The natural healing force within each one of us is the greatest force in getting well, right? We need to support the body in its own healing way. We can't just replace things. We can't just, surgery doesn't solve everything either, right? The body has a way of healing and we need to support that. All right. And it's really important when it comes to GI stuff. Okay. This is our last section. So again, bear with me, please. All right. Gastritis and GI irritation. All right. So this is when we've got inflammation in the lining of the stomach. That's gastritis, and general GI irritation, inflammation along the intestines in most cases. Okay. And we can even have, esophageal burning too. Where, gastritis, again, is a fullness or burning in the upper abdomen, in the pit of the stomach, as they like to say. It's a vague type of pain, lots of belching. And when we got gastritis, so inflammation of the stomach, all right, all that belching does not relieve the pain because, again, we've got irritation, inflammation, and sometimes even erosion in that area. So that becomes a problem. Okay. And if it's severe, it can lead to chest pains, vomiting of blood, dark, sticky, foul bowel movements too, top of that, because of the blood that's getting released because of the mucosal erosion that's happening. But overall, the issue for all of this, alcohol consumption, anti-inflammatory drugs like aspirin, okay? Obviously, surgeries can cause this, and H. pylori, of course, one of the number one reasons why we actually have gastritis, okay? And again, that along with alcohol, the other stimulant stuff, right? Coffee, consumption, spicy foods, acidic foods are all issues for inflammation along the GI tract. So what do we do? And I'm going to work now from up here down to basically the rectum for issues and inflammation and irritation. Okay. So the first thing for people who've got heartburn, all right, they've got this whole irritation from the neck down into the esophagus. All right. We want to provide a coating and decrease the irritation against those mucous membranes that are being irritated. And that's what DGL is for. DGL is licorice extract without that component in licorice that elevates blood pressure, hence the D. All right. So this is a chewable thing that we want to provide a coating for everything down here so that it soothes the lining and prevents the acid from irritating. So really important for heartburn and even any erosion within the esophagus from that excess stomach acid that's coming up. Okay. So it can actually work on the H. pylori, but there's better stuff for that overall, but it is really good for basically coating everything. This is why the chewable is really what you want. Right, coating the whole mucosal lining so that the stomach acid does not irritate it. And you can chew before each meal, after each meal, or whenever the burning starts to happen. The herbal gems. Now, this is something that you might not be familiar with. Herbal gems are a botanical medicine that are using the buds and shoots of plants. So in springtime collection, not the end stage of a botanical, but at the beginning stage of a botanical, because it has a lot more healing properties. It has got all the vitamins, the minerals, the chelating agents, and all the growth hormones that are needed. So they actually help promote better healing. Much more potent botanicals, and they're actually taken like a homeopathic sublingually under the tongue at a very low dosage. Herbal gems, ficus carica, which is fig bud, all right, is one of the best digestive support remedies out there. It controls the gastric juices. It controls the nervousness of digestive health, okay, digestive issues. It controls the GERD that we just talked about with DGL, okay. It really helps to support, drain the actual system and regulates what we call the train or the proper mucosa of the stomach to heal that area much better. So it does more than just lining like the DGL, okay, of this thing. It actually promotes the whole healing process of the gastrointestinal system, and it helps with nervous related issues with the gut. It's a nervous system remedy. So things like stress and anxiety that cause digestive symptoms, this is what fig is for. Now, Gemos, as I said, you're talking 5 to 10 drops, maybe once or twice a day only. Under the tongue, that's it. Pure botanical, not like when we do the other botanicals where we're talking like a half a teaspoon to a full teaspoon sometimes. 5 to 10 drops. Very potent stuff on helping with restore and rebuild the body. So again, GERD, reflux, gastritis, colitis, it'll help with the inflammation all the way through because it's helping with the mucous membrane healing. If somebody has H. pylori, so now we're going a little bit, we've passed the esophagus into the stomach now, where people have the H. pylori symptoms. So this is what causes the ulcer in most people, right? AOR Gastro Relief provides us support for helping to kill off the H. pylori, but also on top of that to start healing the erosion that's there. So mastic gum and ginger, especially mastic gum, helps to kill off H. pylori. It works better than most antibiotics that are given for H. pylori. This formula, along with the mastic gum, has zinc carnosine. And zinc carnosine, along with the vitamin C, are very important for its anti-ulcer properties. So it actually helps to heal the mucosal loss that's happened, mucosal erosion that's happened there. Okay, so getting rid of that burning sensation that's there, getting rid of the major gas and the bloating that's there, the burping that happens because of all of this. So you are killing off the mastic gum, and you are helping heal the erosion with the zinc carnosine and the vitamin C, and helping with the anti-inflammatory effect with the ginger that's in here. But it's the mastic gum and the zinc carnosine which are really important. 2 capsules, basically, before each meal is how you want to take this if there's a true ulcer, or if it's just there's no ulcer and it's just the H. pylori. 2 capsules twice a day is what you're looking at. For inflammation in the stomach and also going further down now, R5. So this is a great addition to what we just talked about, and helping support the symptoms of the irritation, the inflammation, and it actually has homeopathics to promote the healing of the mucosa on top of it. But really, it's about the symptoms of the gastritis, that irritation that's there, trying to decrease the heartburn symptoms, trying to decrease the gas and bloating. It's a great addition to what else we have. And again, you can do this 10 drops any before and after the meals if you need to, depending on the type of heartburn symptoms, the dyspepsia, the intestinal cramping that somebody may have. Into the small intestine now, Genestra's Herbal GI. When we've got erosion happening in the small intestine, we got pain, inflammation, we've got bleeding in the stool, and it's more of a darker red, not a bright red, right? The telling is a little bit higher up. So if it's that, because of the erosion in the small intestine, we are getting the bleeding. This is where Herbal GI comes in, right? A classic formula with the Crane's bill in here, and that's actually one of the key things. Slippery elm, marshmallow, you know about those ones that are great for intestinal mucosal healing. But Crane's bill geranium is actually the key one in here because it actually helps to reduce that bleeding. It heals faster, along with the cabbage, which is very mucilage, okay, to help heal faster so you stop that bleeding. So again, we get that energy back up. We get the absorption back up because of that. It also has the enzymes in the more immediate support, but this is about healing the mucous membranes in the small intestine from the erosion that's causing the bleeding and so on. All right. So when we look at inflammatory issues in the small intestine, IBD, all right, Crohn's, things like that, not colitis, because we're going to talk about that shortly. Okay. Anything like that, this is where we're going to be looking for something like Herbal GI. You're normally talking 2 capsules again before each meal with this. You want to go high to help with the irritation. Once a disease has entered the body, all parts which are healthy must fight it, not one alone, but all, because a disease might mean their common death. Nature knows this, and nature attacks the disease with whatever help she can muster. We need to support the body on all aspects, and we have things like this that does one of the best jobs for the overall digestive healing. Designs for Health GI Revive, I think, is probably the best formula for any irritation, inflammation, allergy stuff, erosions that are happening anywhere through the whole gastrointestinal tract. Yes, it works probably better for the large and small intestine, but you can support it everywhere. Things that we've already talked about, right? DGL, marshmallow. We got L-glutamine, slippery elm, prune plum. These are things we've already talked about. Zinc carnosine for that healing of the mucous membranes. But it also has mucin, so more mucilage, all right? More mucus production to protect that area. We got anti-inflammatories and antispasmodics with the chamomile and the MSM. Okra and aloe, again, very mucilage that are going to help coat and start healing faster. And quercetin for the decrease in the histamine from allergic issues that are causing more inflammation. This guy here has got the best healing effect for the whole GI tract, decreasing the inflammation. So when we think of Crohn's, colitis, IBD, anything like that, this is probably one of the best formulas to be using to help improve gut health, gut immunity, and decreasing allergic response. Gets the regularity back and so on. It's not cheap, but it's very effective. And you might have to do 2 dosages. Not 1 teaspoon a day, but sometimes you have to do 2 teaspoons a day. All right. Depends on the severity. You can go accordingly. Now, you can use things like that R5 we talked about earlier with this if you need to. You can add digestive enzymes, probiotics, and all that kind of stuff, depending on, again, the severity that's there. So, again, one of the best formulas for that purpose. And with IBD, Herbal Gem Vaccinum Vitis Idea, a very unique gemotherapy that has got what's called a biphasic action on the intestines. So it actually helps to regulate the bowels much better. It actually helps to stimulate if it's constipation or sedate if it's diarrhea. That's what it means by biphasic. It never takes it to the other extreme. If somebody's got diarrhea, they're not going to get constipation from this. It's going to actually help normalize it in that thing. So a great thing for IBD. But it also helps to repair the intestinal mucosa and, very important, restores the intestinal flora. So if somebody's been on antibiotics, heavy duty, this actually helps to promote intestinal flora production on top of that. So anywhere where there's inflammation, all right, IBS, colitis, ulcers, Crohn's, right, where we got malabsorption, and we've got the constipation or diarrhea, this is where Vitis Idea comes in. So this is great to use with the previous remedy, no matter what, if they got constipation or diarrhea. Great addition to support that whole state and get the healing going much faster. Again, 5 to 10 drops once or twice a day with this thing. And then the last one I think I've got here is Bio 83, which is for allergies, food sensitivities, which cause excess histamine, excess inflammation, and then decrease the healing ability within the body. So this guy here has got sensitivity reduction to coffee, milk, tomatoes, sugar, potatoes, but we also have adrenalinum, so adrenal, and liver and histaminum support, so decreasing hormonal-related allergic reaction, decreasing overall histamine reaction with histaminum, so decreasing overall inflammation and reaction to practically any sensitivity thing out there. So if somebody has got IBD or they got Crohn's and colitis where any kind of food starts to irritate, if they can't for some reason decrease or get the food out, you can look at the homeopathic Bio-83 to decrease the body's reactivity to that so that we're not causing further damage to the system. Okay, so 10 drops 2 to 3 times a day usually, all right, to decrease the reactivity to these foods. Okay, so a great addition to whatever else we're looking at. Okay, gone a little bit over, but that's okay. All right, real quick. I cannot teach anybody anything. I can only make them think. That's all you're here for with me. Just want to share some knowledge with you. I want you to think about how you can incorporate things in for that individual. That's all it comes down to. That's also why I teach a course. The supplementation course, one of the biggest reasons why we're doing this really quickly, I want you to know, yes, it's starting up October 4th, I think. You'll verify that for me later, till the 29th of November, I think, 9 weeks. That should be the right thing. Very simple. Here's my layout. I talk about it comparatively like this. Okay. I got one quiz that's usually on the first 3 lectures, a small assignment to do, and then you get a nice goodie bag to go with it. And these pictures that you see are a shameless plug to my course. This is what over the years, you get very similar stuff. Every person that takes my course gets, sometimes it changes. You get all these things, depending on with all the companies that I'm working with. All right. You get all of these things. So it's a really nice course to learn about comparative use of supplementation for all the different conditions. But then you also get to try a lot of the supplements that I really like that are going to help you with all of that. So you actually see how the supplements do work for all of these conditions. All right. And then today it was just digestive, but I talk about all of those things. And we'll end it off with this. All learning is in the learner, not the teacher. This is all BS as far as I'm concerned. It's what you want to take out of it. Take the good, run with it. What you don't like, leave it. All right. And I suggest you do that with everyone. And that's why you want to be learning from everyone, from every company. Just take the good, what's useful to you, and go with it. Leave the other stuff aside. This is how you know what's good and what's not, is by learning things. Okay. There's my information. If you have any questions, I'm pretty sure it's in the whole outline somewhere. If you have any questions about this, the course is online again for this one run. I'm hoping we're back in class next May, June, but we'll see how that goes. Okay, so let's stop the share and we will throw it back.
Thank you so much, Belle, for that in-depth and informative session. It was amazing.
You're welcome.
Your teaching is awesome as usual. And I hope that everyone enjoyed the session today. And thank you all so much for being here.